One of the things I like to focus on in my profession is the care of the diabetic foot. The unfortunate thing with lack of care for the diabetic foot can lead to amputation. I like to step in early to do palliative care, whether it be toenail infections, painful calluses, or sores that can occur at different areas of your feet. Namely, a lot of diabetics, their toe becomes contracted where it gets deformed over time and you build pressure in the area. My role as a podiatrist is to step in to get you extra padding, to straighten out the toes if necessary, and to prevent early infection. Over time, with poor control of your blood sugar, your nerve can get damaged. And in the early stages, a lot of diabetics complain of tingling pain of the toes and so forth. The way I treat those is one, obviously work with your primary care doctor or endocrinologist to control your blood sugar. Second thing is I do what we call a nerve block, where I inject vitamin B12 and Novocaine into your nerve. One, to soothe the nerve with the B12, and second, to open up the blood vessel with lidocaine. The main goal for diabetic is once to get you early ambulation, to cut down on some of the weight, to get you to do some form of exercise. It may not necessarily be marathon running, but what I try to do is to, one, either get you swimming, bicycling, anything cardiovascular to get your heart rate going. But in order for us to do that is to prevent any further trauma to your feet. So for instance, if you have hammer toes, crooked toe, or bunions, one important thing is to get you fitted for the right proper shoes. If you have very limited mobility or lack of range of motion, is to get you into some very aggressive stretching regimens such as physical therapy. Our whole goal here is to prevent any sort of limb loss stemming from something simple such as nail infection or callus infection.